I'm Cara Bores, and I'm here with Sabrina Mottershead. We are both graduate students studying speech-language pathology at the University of Akron in Ohio.
We are also specializing in auditory verbal therapy, which focuses on facilitating spoken language in children with hearing loss. We have put together a presentation in response to a problem regarding the lack of awareness amongst midwives about newborn hearing screenings.
It should be noted that this presentation is geared specifically towards practicing in the state of Ohio. The laws in other states may vary.
So, what's the problem? Although the percentage of home births is much lower than that compared to hospital births, the lower percentage does not mean that babies born at home don't deserve to have an equal opportunity for a successful future. In 2011, a group of researchers studied the responses of 518 midwives on a survey about newborn hearing screening awareness. Shockingly, 32% of the midwives responded that it was not very important to screen all newborns for hearing loss. Midwives also reported the need for information about hearing loss conditions and genetics, screening guidelines, protocols for follow-up, referral networks, and therapies available. This presentation, then, is directed towards midwives who feel like they need more information in these areas. Within this presentation, we will address each of these areas as a means of resolving this problem.
We wanted to start off by providing some education on the genetics and possible causes of hearing loss in newborns. You may be surprised to learn that 95% of babies born with hearing loss actually have two hearing parents, meaning their parents are not deaf or hard of hearing. Genetics is the cause of hearing loss in many babies that are deaf or hard of hearing, and deaf or hard of hearing individuals can pass hearing loss onto their children. However, a parent may simply be a carrier of a gene and not be deaf themselves. Hearing loss can also be caused from a variety of other reasons, such as those listed on the screen, or be part of a syndrome. We have attached a link to a brochure created by the CDC that we would recommend as being a helpful reference for you and any parents that you work with.
According to the Ohio Department of Health, newborns are not required by law to have the newborn hearing screening if they are born at home via home birth. With this being said, although the hearing screenings are not required, they are definitely recommended. New mothers and parents are highly encouraged to get their child screened promptly so that if their child does have hearing loss or deafness, they can be identified as early as possible. This is a key component in the success of therapy and intervention for the child. It is required by the state of Ohio that all babies born in hospitals be screened before being discharged. This includes being screened for hearing loss. To ensure that all newborns receive a hearing screening before hospital discharge, the Ohio Department of Health has created an infant hearing program. Not only does this program screen babies for hearing loss risk or risk of hearing loss, but it also provides follow-up coordination to families for babies who have failed their original screening and require further evaluation. If the child receives a non-passing score again, the family is referred to a home-based early intervention service to help the child develop spoken language and communication skills. This early intervention is not mandatory, but it is available for families who are interested.
So, why is hearing screening so important? Well, 1 to 3 of every 1,000 infants born is diagnosed with a permanent hearing loss. Hearing loss can negatively impact the child's speech, language, psychosocial, and academic development. However, it does not have to. With proper and timely intervention, many children with hearing loss can actually develop on pace with their peers and verbally communicate. The American Academy of Pediatrics, along with other prominent associations related to audiology, recommended a 1-3-6 approach to hearing loss intervention. This means receiving a newborn hearing screening by 1 month, diagnosing hearing loss and fitting the child with amplification by 3 months, and enrolling the child in early intervention by 6 months. If you recommend the parents to follow this pattern, the child can be supported and is more likely to follow the typical developmental pattern. It is important to remind the parents that if a hearing loss is not diagnosed promptly, it will be more difficult for the child to learn to listen and speak. The ideal time for learning to listen and speak is between birth and age 4. Later diagnosis and treatment result in poorer performance in listening and spoken language.
So, when you refer a parent to have a hearing screening completed on their child, they'll likely ask you what to expect. You can inform them that when they arrive to have an infant's hearing screened, the professional may perform the screening in one of two ways. Both of these ways may only take 15 minutes or less and do not put the baby in any danger. In fact, many children sleep peacefully through the whole test. One method is called otoacoustic emissions testing. For this test, a probe is placed in the baby's ear canal with tiny microphone and speaker. The speaker plays sounds and the microphone records echoes produced in the child's ear. A lack of echoes may indicate hearing loss. Another method is called auditory brainstem response. For this test, small Band-Aid-like electrodes are placed around the baby's head. Headphones are placed on their ears and sounds are played. The sticky electrodes sense brain response to the sounds. A lack of consistent brain responses can also indicate hearing loss. Informing the parents of these procedures can make them feel more comfortable and increase the likelihood that they follow through with the screening. So, what do you do if your client wants a hearing screening done after their child is born? Well, firstly, you, the midwife or doula, may be qualified to complete the newborn hearing screening on the newborn baby. But if you are not qualified to perform these screenings, then you should recommend by the state of Ohio that the parents bring their newborn to a screening site or to their primary care physician to be screened within 1 month of birth. The screening site that they take their child to varies by state, but Ohio has 2 main early hearing detection and intervention representatives that you should take your child to, and these are going to be discussed by Cara in the next slide.
So, as Sabrina just mentioned, if you're unable to locate an infant hearing screening site, contact the following Ohio representatives for information on how to schedule an infant hearing screening at a location near your client. They are Allison Van Horn and Naomi Halverson. Their information is located on the slide. We also provided a link to search for professionals in other states if you are not a resident of Ohio. If you are in search of an audiologist to follow up after a failed hearing screening, we also provided links to databases where you can search for a local audiologist to perform a full hearing assessment.
So, of course, if the child does fail the newborn hearing screening, the parent may be nervous and not know what the next steps are. You can then take the time to inform them that they can be rest assured knowing that the state of Ohio has set in place an early intervention program that is built to help their child. Help Me Grow is an early intervention service for children aged birth through 3 years old. It's offered in every county in the state of Ohio, and it promotes healthy growth and development through early intervention programs, home visiting programs, and things of that nature. You should inform parents that early intervention is a key component to the success of a child with hearing loss when it comes to acquiring spoken language. During home visits, parents have ample opportunity to ask the well-trained professional any questions they may have, knowing that the professional is both non-judgmental and compassionate. The education that the parent receives from Help Me Grow and the well-trained professionals, as well as the resources they receive regarding typical child development, will help them to maximize their child's development during this critical early intervention period. To enlist in Help Me Grow, parents or caregivers may make a referral for services through their website listed above. Help Me Grow believes that all children deserve the chance to reach their full potential.
Noted here are helpful links, tools, and resources for you, the midwife, to give to the parents who would like more information regarding the ins and outs of newborn hearing screenings. We know that part of a successful life relies on a person's ability to perceive and understand language, as well as having the ability to communicate back effectively. We also know that persons with hearing loss struggle in these areas, and even more so when their hearing loss has not been identified and or they have not received early intervention. Ensuring that all babies, including those born at home, receive a newborn hearing screening will increase the chances that all babies have a successful future ahead of them. We recognize that your position as a midwife or doula puts you in a position that would help make a powerful impact on informing parents of the importance of newborn hearing screenings. So we hope that you feel more comfortable discussing this with them after having viewed this presentation. Thank you all for listening.